that we diagnose with long COVID vary a lot by where we are in the wave. We know that most people with long COVID tend to come through maybe about a month or so after COVID. And so the higher the wave, the number of patients in a wave, the higher the burden about a month or so later. So it varies a lot. We are also in a hospital setting, and most people with long COVID don't come to hospital. So we tend to see the sickest of the lot. Most people who have more mild disease, though, are more seen at their GPs or their local clinics. Most patients' reactions to being diagnosed is one of relief, to be honest, mostly. I think most people do tie their symptoms to COVID because they can clearly identify that COVID was the cause of their ongoing symptoms. So they do suspect something like long COVID, even if they haven't heard that word or that phrase before. So most of the symptoms with people with long COVID tend to be one of either fatigue or breathlessness. And those are really the two common symptoms which occur in every group of people long COVID in every country where it's been studied. The symptoms can be many, and I think it's really just a reflection that long COVID has so many different causes. The treatment of long COVID very much depends, and it has to be individualized. So because of the way long COVID is it's defined, which is really just any symptom longer than more or less a month, it shows that really it's not one disease, but it's probably a bunch of different things all going on with different people, which are all being lumped together as long COVID. So the key when you treat someone is to individualize the treatment, figure out which of the symptoms they have, and then treat those and provide the appropriate management for those. And to give some reassurance that it is going to get better, as long COVID almost always does, and that it just is going to take longer and you need to be gentle and have realistic goals in the short term. That is often enough in terms of treatment. Then the other key component is to make sure that there's no psychological components to this. And then what you do about the specific symptoms beyond that depends on what they have. But this really does require, like I said, an individualized approach and often a multidisciplinary team. So not just the doctor who you go to, but the physio, the OT, the psychologist, and many other parts of rehabilitation all have a key role to play. The most important thing we can do in terms of offering advice to patients with long COVID is really reassurance for the vast majority of cases. It's only a very small percentage of people who have damage to their organs, like damage to their lungs or damage to their heart, that requires medical therapy or that may not recover fully. The vast majority of people with symptoms of long COVID will recover fully. It just takes longer than they used to. And so the more reassurance you can provide, honestly, that is one of the best things you can do for them. And most people are quite able to cope with the knowledge that they will get better as long as you can give them realistic goals.